Institute. Myself, Dr. A.B. Wani, Director CEO of Bilmed Ultrasound Training Institute. Today, we will discuss about the different types of ultrasound during pregnancy. When you go to a center or any ultrasound diagnostic lab, they are, doing some ultrasounds over there, and they are quoting that today is this ultrasound and next time will be that ultrasound. So we'll be discussing of different types of ultrasound during the pregnancy. First ultrasound for a pregnant woman is a dating scan. Second is the early pregnancy ultrasound. In dating scan, it will be the first scan usually at about 5 to 6 weeks, and after that we are having an early pregnancy ultrasound. Then we do have an ultrasound to rule out an ectopic pregnancy. Maybe that this pregnancy is not in the uterus but maybe outside the uterus. That is the ectopic ultrasound scan. If there is possibility of any ectopic, we are going for the ectopic ultrasound scan. Then the very important scan is the level 1 scan. In level 1 scan, that is also called as NBNT scan, we usually perform at about 12 to 13 weeks of pregnancy. Then very important is the level 2nd or a target anomaly scan, in which we are scanning the organs, different organs of the baby. That is the level 2nd scan, which we usually conduct at about 20 to 23 or maybe 24 weeks. Then is the mid-pregnancy scan, which is usually for the fetal well-being, whether the placenta is normal, location-wise, or the fluid is normal, and the growth of the fetus is sufficient. Then the last trimester, the 3rd trimester scan, where we are again seeing for these growth of the baby. That is the fetal well-being scan. So these are the different scans. We do have an option of 3D and 4D ultrasounds also, and we do have Doppler ultrasounds also. If needed, we are going for the Doppler study ultrasound also. So these are the different ultrasounds used during the pregnancy. Now, what is the schedule of different ultrasounds during the pregnancy? Now we will go with this table where weeks are mentioned and what type of scan and what is the purpose of that scan. First, 6 to 8 weeks. In 6 to 8 weeks, we call it an early pregnancy or a dating ultrasound, which is confirming that the pregnancy is there, plus 2 an estimation of the gestational age or the baby's age, whatever is there. Now the second is 11 to 13 weeks, which is NBNT scan. That is the level 1 scan, in which we are measuring the knuckle translucency, where we are checking for the nasal bone, seeing for the the spinal cord, and sometimes the uterine artery Doppler is also added in. So this is the level 1, which we take at 11 to 13 weeks of pregnancy. Then 18 to 20 weeks. In 18 to 20 weeks, there is a TIFA scan. TIFA scan is an anomaly scan or a level 2nd, in which we are checking the anatomical structures and find out if there is any defect in the baby, and we are detailedly scanning the placenta, and this is the very important pregnant scan. So in pregnancy, there are these 3 up to now: early pregnancy, level 1 and level 2nd. Then at 24 to 26, we are going for one other scan, and that is the fetal echocardiogram or the cardiac scan, in which we are evaluating the integrity of the fetal heart. So the heart is to be scanned at about 24 to 26 weeks. Then at 28 to 32 weeks, we are going for this growth scan. That is the fetal well-being scan, in which we are checking for the progress of the baby's weight, growth, status of the liquor, how much the fluid is over there. That is the growth scan, which has been taken at 28 to 32 weeks. Then at 28 to 32 weeks, we are going for the Doppler scan. This is of course optional. Whenever there is need, we are going for this Doppler scan. The purpose is to measure how much blood is going through the umbilical cord to various internal organs of the developing baby. That will be the Doppler scan, which is offered at 28 to 32 weeks, and from 36th to 40th day will be the growth scan Doppler, if needed, of course, if needed. That is checking the baby's growth, position, amount of liquor, and the blood flow to the baby. So these are the weeks, and this is the scan. You can see in the table, this is the scan, and this is the purpose. So these are the different ultrasound which are offered to a pregnant lady. Thank you very much.